Thank you very much, Doug. It's a pleasure and an honor to address you here today. When we think about the global HIV epidemic, for a moment, if we reflect on the fact that there are about 37 million people living with HIV, we get some idea of the scale of the challenge and the enormity of the problem. And when we look at what the current challenges are in tackling the HIV epidemic, one of the most deeply concerning is the fact that we are not succeeding to the extent we had hoped in HIV prevention. Indeed, in the last 5 years, we've seen a serious slowing down in the number of new infections occurring each year. And when one looks at that number of 1.8 million new infections each year and translates that, it comes up with the number that really resonates with me, which is that there are about 5,000 new HIV infections each day. And that's what keeps me going to work and keeping up this challenge and to work with Bruce and all the colleagues at the Ragon. So when we look at this challenge and how HIV prevention is lagging, especially in relation to the global UN target of 500,000 infections by 2020, which we are clearly not going to meet, we get some idea of what are the main contributors to this problem. And when we look at the prevalence of HIV infection in the communities where we do our research, you can see the high rates of HIV infection in women in the red bars. I mean, just for a moment, reflect on 47.8% of women between 23, 24, 25, and 26 years having HIV infection. By the time they get to their 30s, 70.2%. And this is from a large 10,000 person community survey of HIV infection. So it gives you a sense of the enormity of the challenge. And young women are the number one contributor to the large numbers of new infections we are seeing each year. So is this problem unique to KwaZulu-Natal, unique to South Africa? The answer is no. If we look at the map based on UNAIDS data, the red bars reflect prevalence in women, the blue in men. Country after country, South Africa, Tanzania, Malawi, Botswana, doesn't matter which country you look at, prevalence in young women is substantially higher than prevalence in young men. That's the challenge Bruce and I started talking about more than 2 decades ago as we established our collaboration. And so we said, let's start tackling this problem. And we started off by saying, let's build our partnership, but let's do it with specific goals in mind. And in building this partnership in Africa, we were talking about building infrastructure, building research laboratories, building research, developing, training research leaders, but all of it with a very clear goal that what we wanted to do was build scientific excellence. And one of the biggest achievements we've had at the Nelson Mandela School of Medicine is the Keirit and Doris Duke Research Institute buildings, which now constitute among the most state-of-the-art facilities available in Africa. And in doing these studies, in using these facilities and beginning our collaborations, what we have begun to see is the way in which our synergy has worked, the way in which research being undertaken here in Boston at the Ragon in developing vaccines, and then those vaccines being tested by our group in South Africa, by the way in which studies on the microbiome being done here in Boston are translated to work that we are doing in trying to alter the microbiome in South Africa. And one looks at just, for example, in the work Daquan does with Sinai Ngapo, the number of postdocs and doctoral students that are coming out of this initiative. But for me, all of it is now focusing on one of our major collaborations, which is a collaboration between the VRC and the NIH, the IAVI, the Ragon, and CAPRISA, where we have come together with 3 antibodies to look at testing combinations of these antibodies to prevent HIV infection in these young women. And to me, where does all this lead us to? What I see as what the future holds, I believe, is going to be a much stronger collaboration. And we are already in discussions about how we can improve this translational cycle, how we can take ideas of what we're seeing in the clinical realm, that we are seeing at the bedside, take those through to the bench in the lab, and as we develop new approaches, new strategies, to take that back to the bedside. And this translational approach is strengthened by the fact that we are a partnership working together and in concert with each other. So on that note, I'd like to acknowledge and thank Bruce and the team at the Ragon for working with us, for being with us in South Africa, and for making major contributions to the work of research in South Africa. And I'd like to point out that one of the things Bruce did some 20 odd years ago was he asked a young clinician from MGH and Harvard to come to South Africa to work on a study. And she came, had a look at what was going on, found it so challenging and so exciting, she stayed and didn't come back. Let me introduce, ladies and gentlemen, Dr. Krista Dong.